So were you told to do Kegel exercises every day? Maybe your doctor said, do 100 a day, or every time you sit at a stoplight, do your Kegel exercises. Well, what actually does this mean? How do you know if you're doing them correctly? And how do you know if you actually need to do them to help your problem? We're going to talk about that today. And I hear from so many women as a pelvic floor physical therapist, the clients that I treat, if they're dealing with bladder problems, prolapse, back pain, hip pain, or they're going through menopause and beyond, and they were told, just do your Kegel exercises, it'll help support your bladder and help your pelvic floor. Well, many times women don't actually need to be doing Kegel exercises. So we're going to talk about that here. Now, for women who truly have a weakness problem with those muscles, what does it look like? What are your symptoms? And how do you know if Kegel exercises will help you? This is what we're talking about when you are discussing Kegel exercises. The muscles that contract and support your bladder, your uterus, your rectum in this pelvic cavity, it's the bottom part of really what your core is made up of. And those pelvic floor muscles, they not only help with easing any bladder or bowel issues, helping sexual function, and really being that support at the bottom part of your pelvis when you're jumping, running, walking. But they need, just like any other muscle in your body, they need strength, they need endurance, and they need support. So what does that look like? Well, if your diaphragm is here at the top part of your core, your pelvic floor muscles here like a basket are at the bottom, your deep abdominals are in the front, and your back muscles, your multifidus that connects to your spine, is really that support of your core and that inner part of your muscles to support your trunk, and down here supporting your pelvic organs. Well, doing Kegel exercises is told a lot of times to women when they go to their doctor and they're having some bladder leaking, or they have a prolapse, pelvic organ prolapse, which I have other videos on this channel explaining what that means, or they think it's a normal part of aging, is just keep working on strengthening those muscles. Well, for women that are having any kind of pelvic pain, like pain during intercourse or tailbone pain, anything that creates discomfort in that area, you may have more constricted pelvic floor muscles and they have been shortened. So doing hundreds of Kegel exercises a day is not actually advised to make your problem get any better. You, just like a bicep muscle, just like your back muscles, when you have tense muscles, sometimes they get painful. And if you keep doing strengthening exercises, it can make your problem worse and it's not going to get better. So for the women that I treat, there's a lot of down training and working on relaxing the pelvic floor muscles and getting them to actually let go instead of strengthening them all the time. So it's just as important to work on a contraction in a muscle in your body, but also work on the relaxation part. And I think this part is not described all the time when women are told to do Kegel exercises. They don't actually let go of the muscles. So I want to talk to you how to do a Kegel exercise and how to do it correctly, because it is important to have support of those muscles there, but not firing them 100 times a day or all the time when you're walking and thinking about it. When I described your core muscles and what that means, your diaphragm here at the top is controlling your breathing. And when you take an inhale through your nose, your diaphragm drops to create more air and space in the lungs. And then as you exhale, you breathe out through your mouth and the diaphragm moves up. Well, this creates less pressure in your pelvic cavity. So when you're using your breathing with a contraction through your core, any kind of core exercises, or through a Kegel exercise, you're actually going to make your trunk muscles be more efficient and get stronger and more effective. Now, if you're doing a Kegel exercise, you can imagine your vaginal opening. This is how I describe it to my clients. If it's holding a blueberry in that vaginal opening, you want to imagine you're squeezing the blueberry and tightening the vaginal opening. Or if you go from your urethra to your anal opening, you're pulling those together and tensing those muscles right between your legs. Now, for a lot of the women I see, they tighten their butt muscles, they tighten their abs, they're trying to use all their might and all their hip muscles at the same time when you're doing a Kegel exercise. So see if you can lie down on your back with your knees bent, relax all your muscles, and try just tensing that little area between your legs and see if you can isolate that on its own. Many women can't do this, but it takes practice, it takes repetition, and it takes your brain really connecting to those muscles to understand how to do it without getting everything else to contract at the same time. So that's usually how I start with my clients when they're a little more relaxed and they can just imagine that blueberry analogy, or imagine from your pubic bone up to your navel, you're just tensing and drawing those muscles in and up. That would be a Kegel exercise. Now, to do them properly, we're gonna add the breathing. So if you take an inhale and you release those muscles and let them go, the most important part, and then on your exhale, you're contracting. So if you sync the Kegel with your breathing, that is the best way to do it. Inhale, you stay relaxed. It's like a flower opening, that pelvic floor lets go. And then you contract on your exhale. This creates less pressure in your abdominal cavity and sets you up for success if you're going to lift anything or preventing bladder problems and prolapse and other issues that women can have as they age if they're not doing their exercises appropriately. So work on the breathing with the Kegel exercise, but if you truly are having pain with intercourse, you're having any kind of tailbone pain or pelvic pain, then Kegels may not be a good idea for you. Consult with a pelvic floor physical therapist. Now, if you're doing Kegels for helping your bladder leaking problem, your incontinence, or some other type of issue that you're having down there and you were told to do Kegels by your doctor, but your problem is not getting better after practicing this for 3 or 4 weeks, then you definitely want to see a pelvic floor physical therapist. You can go download or go to my website and take a look at my book. I have lots of other tips and info to help you solve these issues from my book there. So take a look at that link. And if you're a woman who has been told to do Kegels and maybe you're doing them wrong, comment below, because I hear this all the time that women don't even know if they're doing it correctly. So I hope you learned something from this video, because they can be effective if you truly have weakness down there or lack of muscle support and control. Now, for women that haven't subscribed, I would invite you to subscribe to this channel. We have lots of other tips for women to help with their bladder problems, back pain, all these other issues that women go through 40 and beyond and as they age. So click subscribe if you haven't already. And I hope you learned something. Thank you so much for watching.